What's up, everybody, and welcome to this week's episode of the Wellman's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing wonderful. I want to just talk about some things, again, that we can do to boost our immune system.
Yes.
And the particular thing I want to talk about today, which not many people talk about, seems to not get a lot of respect, is the mineral zinc. So anyway, let's just get right into it. But I want to start off with a lot of the notes that I got today come from a guy named Donald Yance. He's a master clinical herbalist and a clinical nutritionist. He's one of my mentors, and I pulled a lot of this information off his blog. So you guys check him out, Donald Yance. He's one of my favorite herbalists, one of my teachers, but a lot of good information on his blog. So a lot of the information that Brian and I are going through was taken from one of his blogs. So anyway.
How do you spell that last name, Keoni?
Yance, Yance.
Okay.
Yeah.
Cool.
Yeah, he really knows his stuff. Anyway, but at the beginning of his blog, he just talked about, vaccines. And we talked about this too with the coronavirus talk that we did. Vaccines are really wonderful things. They can save lives and everything. But, the really crazy thing about viruses is they mutate. So you always have to reformulate the vaccine. So,
right.
Once we get out of this
flu shot.
Right. There's probably going to be a new coronavirus shot at some point if we ever come up with the vaccine. So it's constantly this battle between, the viruses and then, us coming up with a vaccine. And a lot of times the vaccine really lags in time, and the virus already has done its destructive stuff already, and the vaccine's not there in time. And vaccines aren't 100% fail safe either. So one of the things about what we do is we constantly talk about, hey, one of the best defenses you have, like, to prevent getting infected, and even if you do get infected, is supporting your immune system.
Yeah.
So we just need to bolster our immune systems, and there's tons of things that we can do to do that, right? I mean, prevention is key. We talked about that, the hand wash and the wearing of masks, that type of thing, social distances, and so on and so on. But there's so much that you can do that they're not really talking about as far as supplemental nutrition goes, and nutrition in general, and basically lifestyle stuff, adequate sleep and that type of thing.
Yeah, absolutely. But they should be up there on the pulpit talking about zinc.
They should be, yes, because what we do know is zinc is really a great antiviral fighter. I wouldn't call it an antiviral per se, but what it does is it really boosts our immune system. We've seen that for a very common viral infection, the common cold, we have good research showing that it will shorten the duration of colds and even flus if you have a good amount on there.
Wow. Yeah, I was wondering if we know, Keoni, like how it bolsters the immune system. Like, do we see an increase in white blood cells or neutrophils or things like that? Or do we have like the report you just mentioned where it's kind of like we can tell that their symptoms decrease compared to someone who didn't?
Well, yeah, both. You see both. You see that the immune system, even at its smallest detail, seems to be optimized. And then you also see symptoms. People are able to fight off these infections better clinically. And we'll get into that a little bit here to go into a little bit of detail into that. But zinc is an essential trace element. It's crucial for growth, development, and the maintenance of immune function. That's key. We know that. We have a lot of research on that. Its influence reaches all organs and cell types. It represents an integral component of approximately 10% of the human proteome and encompasses hundreds of key enzymes and transcription factors. We've touted the mineral magnesium. We always tout that one. This is one we definitely need to start touting for immunity and helping people fight against certain illnesses. And unfortunately, zinc deficiency is strikingly common. I mean, it's affecting up to a quarter of the population in developing countries, but also affects, a significant part of the population in developed countries also, like ours. And the reason why it causes, maybe people may be deficient is really a result of lifestyle. Age plays a big factor. That kind of, the older you are, you may be subclinically zinc deficient. Hence, you're not going to fight off colds, flus, and different viral infections as well.
Is that the biggest side effect of being deficient? Like there's no like with vitamin C where you get like scurvy or something like that.
Oh, well. So anyway, it's if you are deficient, you can get growth retardation for one. So in kids, it's very important. You can get loss of appetite, definitely impaired immune function. In severe cases, you get hair loss,
Wow.
GI problems. It's very important for male health. Delayed sexual maturation. It can be a cause of impotence. You get that hypogonadism in males, skin lesions you can get, weight loss. One of the big things with zinc deficiency is you can have delayed healing of wounds. You get taste abnormalities, mental slowness. I mean, the list go on, and I know there's a lot of overlapping things. So there's no one clinical symptom that you could just point to and go, oh, well, that's zinc deficiency.
Zinc.
Yeah.
Right.
It's
a good list there of running through where you can understand when you would possibly want to even increase your dosage. Like I think of spinal cord injury. If you have a deep tissue injury or some sort of scratch that then becomes a more significant scar or injury, or like cut there, abrasion, zinc would be beneficial in helping heal that up. And it's often in topicals from what I've seen.
Yep, it is. And it's very, very important in burn victims because you will lose zinc like you would not believe through the wounds. And so you really want to make sure that you're supplementing with zinc.
That's awesome. That's when I saw it be used as a topical.
Yeah. Let's see what else here.
Sorry, I definitely cut your train of thought right now.
Oh no, it's fine. No, I want you to
rob the train.
Yeah, no, I definitely want you to. Because I think people that are listening to this are going to have the same questions. So if they come up, just ask, and if I can answer them, I certainly will, based on our research that we did on this. But anyway, zinc is a critical factor, and the research is really states this when you look at it. It's critical factor for antiviral immunity, and that's why I wanted to do it today, since we're going through this pandemic. And we see this a lot with zinc deficient populations are often at most risk of acquiring viral infections, according to studies, and that includes HIV and hepatitis C. So we can think about zinc, if you will, as a broad spectrum kind of immune booster, or broad spectrum kind of like antiviral, if you will, even though technically it's not. Right. And the nice thing about it is you can get it through your diet and stuff like that. But we'll go through that and what the regular doses are and all that, how people can get in there. But this kind of hits on the question that you had, Bryan, like how does zinc actually support immune function? And without getting into details, well, it enhances both innate and adaptive immunity. Okay, so your innate immunity is, if you have for example, let's say you have a cut, and what happens is your innate immunity immediately goes into getting rid of any infection that would be there. Like it's your white blood cells going there and eating up the germs that may have gotten into that wound. Okay. Adaptive immunity is the immunity that we think about when we're talking about vaccinations, and basically that's you get infected with a virus, a novel virus, your immune system does not know what to do with it. So what does your immune system do? It takes your part of your immune system tries to create very quickly, in a sense, antibodies to it. And these antibodies can attach to the antigen or the virus there. And now it marks each of those antigens as something foreign. And now your immune cells can take care of it. Right. So that's what's going on with this virus right now.
And you're getting reinforcements at both ends there with zinc.
Yes, that's right. And zinc does it both, innate and adaptive immunity. And then the other thing it does is for your immune cells of almost all types. So we're talking about natural killer cells, your beta cells, your T cells, all of these things. It enhances that function. And then on top of that, it will modulate inflammatory processes. So it will help keep the inflammatory processes that are needed when you have an infection and keep them at a level that's not too much or not too little. It's kind of like it helps it find that Goldilocks point to fight the infection. So people with zinc deficiency that are supplemented with zinc, and this is actually a number of studies that are supplemented with zinc, improve cytokine production and immune cell survival, maturation, and function. So cytokine function, just to review, these are the little chemical messengers that your immune cells send out into your body to, kind of summon the reserves to help fight the infection. And sometimes that can go overboard, right? And you can get a cytokine storm. Well, zinc may help quell or optimize the cytokine production so that you don't get this storm, and then hence it damages your lungs and the rest of your organs. So zinc is important there.
Helps you have the best response or an optimal
response.
It
just helps you have a good response. So zinc is essential for immune cell development. So it helps mature immune cells. It helps maintain activity of immune cells. And this includes all of them: neutrophils, monocytes, macrophages, NK, natural killer cells, beta cells, T cells. And then there's a couple studies out said a deficiency leads to impaired immune function, promotes systemic inflammation. So a deficiency of zinc, which is really simple to get into your diet, promotes systemic inflammation. Well, inflammation's not good, especially when you're trying to fight a virus. And in studies with both young adults and elderly subjects, oxidative stress markers and generation of inflammatory cytokines decreased with supplementation of zinc. That came those studies that I'm kind of summarized there with that statement there. One is from Molecular Medicine 2008, and the other one is from the American Journal of Clinical Nutrition 1998. So zinc is essential for virtually all processes in the human body. We know that significantly, if you don't have enough, it severely impairs immune response. So think about this. I mean, and I don't know how you would study this, but think about if before every cold and flu season, there's a government mandate or at least a suggestion or a recommendation to take a good multivitamin with some zinc. That's going to make a difference.
Right.
Instead of the mantra being multivitamins don't work, therefore don't take them, or you're just going to pee them out, and that's kind of what is being told to the general public. And the people in the know, like us and stuff, say, well, that's not true. Yeah, there are better vitamins out there and stuff, but getting some zinc in can certainly help. And it shouldn't be looked at as pseudoscience medical quackery.
Right. Yeah, absolutely. Keoni, is there a type of zinc like magnesium bisglycinate that's more that we want? We want to check our label.
That's a great question. And really the best form of zinc is the zinc that comes in its natural form. Okay. And it's kind of like when we talk about vitamin C, when you go to the store, you get ascorbic acid. That's really not how vitamin C comes in the natural world, right? When you eat fruit or something like that, it comes with all these cofactors and other things that just help vitamin C work better. There's a form of zinc that's not readily available over the counter. Anyway, it's called naturized zinc, and it basically is zinc that's comes from food sources with all the cofactors, and it's called naturized zinc. And the reason why I bring that up is because this is what Donald Yance really likes, and it is better absorbed. But I will say this: the zinc that you can get over the counter, most of them are fine. So if you find zinc in like lozenges, like zinc gluconate, it's like in a lot of those lozenges that you find like at the checkout counter at the food store. So, that's going to be fine, and you're going to get some benefit from that. The zinc I primarily will use, besides a naturized form of zinc, is zinc picolinate. And I think that's probably the best absorbable form of zinc that people can get. And I think you can find that in some over-the-counter products.
Okay.
But like vitamin C, you really want to make sure that you have a well-rounded diet so that when you do take in zinc, that your body is able to utilize it optimally.
And right? I know you listed it before, but the foods that are kind of high in zinc, the seeds.
Yeah. So yeah, let's talk about that real quick, because the foods highest in zinc include oysters. All right. So
are you a fan or not a fan, Keoni?
It's not something I would go out of my way to eat. Let me tell you that, because some people absolutely love them. I just, but they are very, very high in zinc, and this may be part of the reason of the mystique around them as being kind of like an aphrodisiac because of the high amount of zinc. I mean, as far as like male sexual function, it does have an impact. Like having optimal zinc levels does have an impact on male sexual function. Not only that, it also, zinc is required for prostatic fluid and may even help with having a healthy prostate. So we do have some research on that. But the highest amount per serving of foods that we Westerners, Americans, and other Americans that normally eat are oysters. After that, the foods that tend to be the highest tend to be in meat and flesh type foods. This is one of the reasons why certain populations like vegans and vegetarians may have issues with not getting adequate zinc because they're just not eating this. And then on top of that, if you eat a high vegetable plant-based diet, which we all should, but if that's all you're eating, a lot of times there's certain compounds in those foods called phytates, type of fiber, that binds up the zinc that you eat and won't let you get it in. So you can't absorb it well. But as far as like vegetarian foods go, I think probably the highest source is going to be pumpkin seeds.
Oh yeah. One time I was at your house, Keoni, I don't know if you remember, but you were eating pumpkin seeds. You handed me like a handful and you said, they're good for my nuts.
They are. They're very good for that. And it's this is one of the minerals that does have a wow factor with some men. So I've had some of my patients take, I give them extra zinc, and they really did have like this kind of wow factor, like, wow, that made a difference. Because, most of the time when you take a multivitamin, if you're generally healthy, you don't really notice anything. But I have noticed something with supplementing certain patients that may be deficient in zinc, and they really got a good benefit from it. But yeah, pumpkin seeds is probably the highest vegetarian source. And then after that, you can just think about nuts and stuff like that are really high. Legumes are pretty high. Oatmeal has a little bit in there, but you're talking about, so if I'm like, pumpkin seeds have per serving have like 2.2 milligrams per serving, compared to oysters that have 74 milligrams per serving. Yeah. And the recommended amount of getting zinc in per day is I think 11 milligrams. Okay, 8 to 11 milligrams, depending on what your situation is. So for example, if you're vegetarian, you want to, or vegan, definitely you want to be on the higher end of that spectrum, right? And probably go a little bit higher than 11. If you have an issue with alcohol or an alcoholic, you're going to be very low in zinc. That will knock your levels down. Pregnant women need more zinc. Burn victims need a ton of zinc. So it just depends on where you are.
Can I have too much, Keoni, or will I self-regulate?
You for the most part, you will self-regulate. There are studies out there that say that if you are taking more than 100 milligrams of zinc for an extended amount of time, I think that extended amount of time was like a month, 2 months, there was an increased risk of of certain type of cancer. I think prostate cancer for men, which is
Hmm.
interesting.
That is interesting.
But in the amounts that you're getting in a multivitamin tend to be about 15 milligrams per serving a multivitamin. And during colds and flu seasons, it's perfectly okay to up your dose of zinc to 30 to 50 milligrams a day on top of a healthy diet.
Okay. And do you know why oysters are like the highest or are so high in zinc? Like, do you have
I
any understanding of their properties there?
I don't know why. I do know that certain seafoods tend to be pretty high. I don't know why I don't know what's going on there, why they tend to be so high.
Okay. And then after that, in the meat category of being high in zinc, the highest in that category is seafood.
I would say I would say overall seafood. I mean, with like beef, red meat, mm-hmm. Like I pulled this list off of I think it was off the FDA website, but beef chuck roast braised 3 ounces has 7 milligrams per serving, whereas Alaskan king crab has 6.5. Okay. So beef tends to be pretty high. Lobster cooked 3 ounces has 3.4 milligrams. But once you get past that, it drops off significantly. Like they put baked beans in here. Baked beans are pretty high for kind of a vegetable based food, and that was like around 2.9.
Okay.
But really, pumpkin seeds tend to be a really, really good source, and then any nuts and stuff like that really help.
And we're looking for about 15 milligrams a day.
I would say certainly anywhere between. I think you're going to be good at anywhere between 15 milligrams up to 50 milligrams a day. I mean, once you get up to 50 milligrams, I think that's a good preventive dose to take, especially during cold and flu seasons, things like that. All right.
So an oyster every other day keeps the PP strong and the flu away.
Yeah, that's right. Oysters are key. Although I don't eat them a lot. I know some people that absolutely love them, but so. Anyway, so how would we be able to tell, like, besides having like symptoms or clinical signs and symptoms, which are very, they're not specific if you're zinc deficient, like we talk about growth retardation, things like that, fatigue, like all these symptoms are just very nebulous. We can't point our finger and say this is zinc deficiency. Well, you can certainly do a blood test, all right, and that would tell you. But again, with that blood test, and it's a zinc serum test, and with that test, okay, so let's say it comes back and shows that you are replete in zinc. So you have, according to that test, enough zinc, but it tells us nothing about what's going on inside the cell. So there's you don't really have a good way of testing. I mean, unless you're significantly deficient, then it's going to show up on a blood test.
Okay.
Now, in medical school, I was taught, and a lot of functional medicine practitioners were taught about a test called a zinc tally test. And what that is taking a solution of liquid zinc, and a lot of some nutraceutical companies will say, here's a zinc solution. And what you do is you pour a little bit in a cup and you have your patient taste it. And they swish it around in their stuff. Somebody who is zinc sufficient, has enough zinc, will taste that zinc and think it's one of the worst things that they ever tasted in their life. Somebody who is zinc deficient or not have enough will not taste anything. All right. So zinc is so that's a good, more of a functional test to assess zinc status.
Yeah.
And it's a very easy test to do. You can do it, right in your clinic room with just a little bit of zinc. And it's really interesting. People who can't smell, by the way, or who've lost taste, probably have subclinical zinc deficiency, especially if we don't know the cause.
Now, I don't know if it works this way, Keoni, so correct me if I'm wrong, but I hear that losing your sense of smell and taste is one of those first symptoms of the coronavirus, possibly. Is that, are these symptoms more so a symptom of the virus or a symptom of the deficiency, or do we have any idea? Do you lose zinc levels as you get more ill?
Well, absolutely. Yes, you do. As you get an infection, yes, you're going to be using up your zinc stores. Absolutely.
Okay.
You certainly will. But that's a great point, because what if we find out the loss of smell and or taste being some of the first signs of having the coronavirus is actually due to having subpar zinc status? That's very interesting. And that I don't know.
Yeah.
But that would be very interesting to find out.
Yeah. Ask Dr. Fauci.
Yeah. See what he says on that.
We'll get him on.
Yeah. Yeah. That'd
I'm
be
sure he's not
great,
busy.
right. Anyway, so I think, just to reiterate, I think we can think about zinc as a direct antiviral as well as a stimulant of antiviral activity, right? So it stimulates your immune function.
Yeah.
But as a direct antiviral too, which is pretty fascinating. It has been used therapeutically for all types of viral infections, from herpes simplex virus infections to common cold, flu, and it can be virus specific, but it also has general broad spectrum antiviral activity. So it's great. With colds, it seems to reduce a cold or the duration of the cold by almost up to like 40%. So that's really cool. I mean,
Yeah.
the average cold can last, I think, what do they say, 7 to 21 days, and you're pretty darn miserable when you're dealing with that. And zinc can really shorten that significantly.
Yeah.
That's after you get the infection.
Yeah, it's a real shame that this isn't. You don't get a bottle of zinc as well with your prescription or whatever the case may be.
Right, or that we're not even talking about this stuff.
Right.
It's kind of like one of those things where I think people just blow it off, go, oh, well, you're getting enough in your diet, the American diet, which is absolutely not true.
Yeah.
It's not true. This is really interesting. And I think I actually have a study for this, but research shows that severe acute respiratory syndrome, SARS, coronavirus, the SARS coronavirus, was inhibited by zinc in what we call petri dish cells that are they're called Vero E cells. Anyway, these cells are basically what you do studies on, and they're very good at helping replicate viruses and stuff like that. So, they basically what they did is, expose these cells that were infected to zinc and had really good results with it. And again, that's in the petri dish. But that study, if I'm not mistaken, came from immunology aging, I guess, 209 year 2009. The title is The Immune System and the Impact of Zinc During Aging. So I think that's where that came from. But that's a study that shows benefit there that has direct relevance benefit to what we're dealing with today.
Right. Direct benefit.
Yeah. As we know, one of the most serious conditions associated with flu is pneumonia, and it's also one of the most common reasons for death, right? Associated with influenza. This is a big deal because we deal with this every year now. An analysis of randomized, double-blind, placebo-controlled trials shows that zinc is highly effective when given as an adjunct in the treatment of severe pneumonia. So it hits on what you just said. Why aren't we giving people some zinc along with their conventional treatment? Yeah. Right. So basically, with the Cochrane review, they did 6 randomized, double placebo-controlled trials. This included up over 2,000 people with severe pneumonia, and what we found was zinc produced a significant reduction in mortality caused by the severe pneumonia. All right, so that is what journal? I just want to Clinical Respiratory Journal. The year is 2018, so it's relatively recent. Efficacy of zinc given as an adjunct to the treatment of severe pneumonia, a meta-analysis of randomized, double-blind, and placebo-controlled trials. Clinical Respiratory Journal. So, March 2018.
We'll take it.
Yeah.
I mean, really.
Zinc supplementation improves recovery in respiratory infections. All right, so there you go. So after you get the infection, zinc, you don't have to take this before, you can take it during, right?
Yeah.
So zinc has been shown to be supportive in recovery of severe respiratory infections. A study of children with acute pneumonia reported, let's see, I think out of Bangladesh, we had a 30% reduction in the duration of illness and severe pneumonia with zinc supplementation. Study out of India, 2.6 times increase in the recovery rates from severe respiratory infections using zinc supplementation. Nepal, more than 2,600 children enrolled in a study to find the impact of zinc as an adjunctive therapy in pneumonia. The conclusion was zinc was found to have a therapeutic benefit not only in that trial, but in all the ones we just mentioned. So, what's the downside?
Efficacy behind it, yeah.
Yeah, what's really the downside to it? There's really not any downside. I will go over some things with it that can be problematic, but there's no big downside to it unless you're taking large amounts of zinc for a long amount of time.
Mm-hmm.
So, the other things I just to review, just zinc deficiency, you can have abnormal neurosensory changes, right? So that kind of hits on the smell and maybe taste and stuff like that. Emotional disorders are associated with it. Again, delayed wound healing. You're not going to heal well if you don't have zinc on board. And then there's some common things that zinc deficiency is involved with that actually have been, we were at first in medical literature, we weren't really sure what they were coming from. Like a lot of these things were thought to be viral illnesses, but current aphthous stomatitis, those are, the common name for that is canker sores. People who get a lot of canker sores, they're finding that they may be a little bit low in zinc. So there's one sign that you may be deficient in zinc. Xerostomia, I'm actually doing a study with using acupuncture on xerostomia after radiation treatment, but xerostomia is dry mouth. So these people can't really secrete saliva well at all. They just have dry mouth, and zinc may help with that. Oral lichen planus, I've had a number of patients over the years with this. That may be a sign of zinc deficiency. There's also something called burning mouth syndrome. That may be a sign of zinc deficiency also. And then atropic glossitis, and that's, again, like dry mouth, discomfort, the oral mucosa is not functioning properly. Again, maybe a sign of zinc deficiency.
A few things in the mouth.
Yeah.
Which is just interesting to note.
Well, it is interesting. I know myself that when I'm under a lot of stress or whatever, and most of the population has herpes simplex 1. That's the oral form of herpes. Like, if you, especially, I think it's up to 90% of the American population has that. But anyway, it's when under stress or when you don't have enough sleep, some of our viral friends like to come out and play. And a lot of times they'll show up as sort of these mouth ulcers or these lesions around your mouth, like the HSV1 lesions. And it could be due to not having enough zinc on board.
Yeah.
Let me talk a little bit about the right doses, even though we talked about zinc. I mean, and some of the things that people have come across as far as having some side effects from zinc.
Yeah, you got some guidelines for safe use.
Right. So you're going to be pretty safe taking zinc long-term between 15 milligrams and 30 milligrams long-term. I don't see a downside to that. However, some forms of zinc, if you take it on an empty stomach, can make you feel really nauseous and give you gastrointestinal distress. So some people say, so if you do get that from taking any zinc supplements or multivitamins, sometimes it's due to the zinc, is you may mitigate that by just taking it with food. Taking zinc long-term can also, especially at high levels, can also cause copper deficiency. Okay, so, and On the other hand, excess copper intake and excess iron intake can cause zinc deficiency. So you just want to have a balance of those.
And those three aren't going to show up on your comprehensive metabolic panel, correct?
Zinc will not. You can get some idea of iron status based on a CBC, but zinc and copper you won't see on a regular CMP. Yeah, you'd have to do specific serum tests for that to see if it's really there. But again, you go back to the place where, what does it tell us that what's going on in the cells, and we can't really tell from that.
Mm-hmm.
There's some indication that your liver uses a lot of zinc. Anybody with poor liver function can have problems with zinc optimization. Other diseases that cause low serum zinc are anything of the GI tract, right? So if you have any issues with your GI tract, you're not going to absorb zinc well. So we're talking about Crohn's disease, ulcerative colitis, bypass surgeries may.
And is your response to that malabsorption increasing the dose? You take something to fix the original problem, you treat the problem and then hope that your absorption corrects itself, or how do you act on that, Keoni?
A little bit of both. So you can kind of push the pathway if you want with zinc, but you want to fix the problem too. So somebody who has any type of GI issue, you could probably give them all the zinc in the world and they may not absorb it well. So you have to fix the gut, heal the gut, so to speak. Let's see. I think we've talked about most of that. Let me just go through some highlights based on my research. Hepatitis C patients with high zinc levels. Let's see.
They exist.
Yes, they exist. Anyway, I'm just reading the study. Basically, hepatitis C patients with optimal levels of zinc tend to do much better than ones that don't. That's basically the summary of that. We already talked about oral zinc is shown to reduce the length and severity of a cold and common flu. So what else? Zinc deficiency increases oxidative stress, resulted in activation of monocytes, macrophages, and generation of inflammatory compounds. If you don't have zinc on, guess what? You're not going to fight infections well. So it's all stuff that we already talked about.
Yeah, absolutely. Seems like something that should definitely be added to your supplement cabinet and your general routine.
Yep. I would say like during cold and flu season, I think one of the, as far as supplementation goes, is if you're taking a multivitamin year round, a good one that has zinc in there, you're probably fine. During cold and flu season, maybe you may want to bump it up through diet a little bit, like making sure you're getting some of your oysters in, or some of your pumpkin seeds in. If you do get colds or flus, you definitely want to increase the level of zinc.
Yeah, perfect. It's really a shame that this stuff just isn't. When I turn on the news and watch a 90-minute long press conference about any sort of virus, they don't talk about this at all.
Right.
It's just a shame.
Here's another thing I came across through Donald Yance's research, but sepsis, zinc and sepsis. Sepsis is a life-threatening organ dysfunction condition. I mean, sepsis, you can think about, everything just shutting down and being overwhelmed with infection, and this is kind of what happens after a cytokine storm. Like if you don't get through that, then the infection completely and the cytokine, the oxidation, the oxidative stress on the body just causes body-wide organ failure. So during sepsis, a during sepsis, a redistribution of zinc from serum into the liver has been observed, and several studies imply a correlation between zinc and sepsis outcome. So therefore, the alterations of zinc concentrations in different tissues might serve as one part of the host defense mechanism against pathogens during sepsis by diverse mechanisms. It has been suggested that zinc is involved in nutritional immunity, acts as a hepatoprotective, so it protects your liver, hepatoprotective agent, or a differentiation signal for innate immune cells, or supports the synthesis of acute phase proteins. Further knowledge about these events could help in the evaluation of how zinc could be optimally applied to improve treatment in septic patients. Anyway, this is coming straight out of Donald Yance's paper. You can go to his website or his blog, and he has everything cited there and all the research papers there. So sepsis and zinc. So
yeah, so again, like it's just stage. Useful, real acute. Yeah, exactly.
Yeah. We talked about male health a little bit, touched on that. I think zinc could be thought of in some respects as a male type mineral, but then it certainly helps women too. I mean, but it seems to have a particular affinity for the male prostate and helps that as long as you're not taking too much. And too much was the 100 milligrams per day. There's a study that showed over that can cause problems.
Which is more than one oyster.
Right.
You gotta be eating a seafloor a day to.
Right. So that's kind of everything I wanted to go over. Zinc is basically an essential trace element for all living organisms and biochemical processes. It is absolutely vital for our body. It's involved in over 300 to 400 enzymatic reactions. It's kind of like a big player, kind of like magnesium is a big player. And it's pretty easy to become subclinically deficient in it. And for some people, even clinically deficient in it.
Yeah, we might have to add it to the Well Man's Podcast drinking game.
Right.
So it's up there. It's important.
Yeah. So when we face these pandemics, or when we face any of this stuff, cold, flu season or whatever, I mean, zinc should be a foundational thing that we think about.
Yeah. Awesome. Thank you, Keoni. Be well, everyone. We'll talk to you next week.
Yeah. Thank you.